The pandemic hit South Texas particularly hard this summer, and so far it has shown no signs of slowing down in that region. The border city of Laredo, Texas, has reported nearly 8,500 positive coronavirus cases and 175 deaths. And with those numbers, unfortunately, on the rise, here to discuss the situation in South Texas is Laredo Mayor Pete Saenz. Thank you so much for being with us, Mayor Saenz. And I know last week we heard from officials warning that 2 hospitals there in Laredo were already at capacity. So what are you doing to make sure everyone in your community has access to medical care?
Well, thank you so much for the invitation, and hello and buenos dias from Laredo, Texas. Yes, we have a situation that's critical here in Laredo, Texas. The numbers have been going up positives. We have 175 people that have passed away. Hospitalizations are up, and yet some of the people are being transferred to other hospitals, particularly in San Antonio. So it's critical here, and that we're doing the best we can to spread the message to the residents here by every means possible, that so they can get the message, wear the masks, don't congregate, and of course that socially distancing is so important. And we're doing the best we can.
Yeah, doing the best you can, Mayor. But what do you need? Are you getting the support that you need in the state right now of Texas to prevent something from snowballing, making it an even bigger crisis in your city?
Yes, we are. Relatively speaking, we have. The state has provided resources to us. They've provided over 300 personnel, staffers, doctors, nurses, technicians. We're in the process today of meeting with the state people to consider an alternate site also to help relieve the pressure of our hospitals. So we are considering that the entire state of Texas is undergoing also the COVID-19 pandemic situation. So we understand that the resources may be tight, but we're getting what we need.
Yeah, we heard from the county medical examiner there that between border crossing attempts and COVID-19, Laredo's morgue is now at capacity. How is your city handling that?
Well, they're bringing in more coolers. The responsibility belongs to the county, and of course the city is there to assist. But so far, we've been able to manage and control that by bringing in cooling units to keep the bodies for the time being.
Yeah, I know it's such a difficult thing to try and manage. And I know as well 2 detention centers there in Laredo have already suffered outbreaks this summer. How are you stopping that from becoming a bigger problem in those facilities?
Well, luckily we have a very experienced medical authority with us. They've been testing and segregating. They segregate the positives and negatives and within the same facility. And then they wait until 14 days have expired with no symptoms before they can actually release that facility from a quarantine aspect.
Mayor, final question. Last week, U.S. Customs and Border Patrol announced a new contract to build 17 miles of border wall there in Laredo. What effect do you think that will have?
Well, the impact is quite quite out there. I would say our policy has been no physical structures, but yet the federal government has pursuing the wall. They've issued that contract, and we'll just wait and see what time brings. I know that we've challenged, and others, private owners have challenged legally that position of the federal government, but only time will tell.
Well, we know you have been incredibly busy protecting and serving your community. Laredo, Texas Mayor Pete Saenz, thank you for all you're doing, and thank you for being with us today.
Well, thank you so much. And from the #1 land portal, Laredo, thank you for taking interest in us.
Hi, everyone. George Stephanopoulos here. Thanks for checking out the ABC News YouTube channel. If you'd like to get more videos, show highlights, and watch live event coverage, click on the right over here to subscribe to our channel. And don't forget to download the ABC News app for breaking news alerts. Thanks for watching.